Guys, my voice is clear for you now? It's better than it was before or not?
Yes, it's clear.
It's more clear, yeah? Okay. So let's wait
اه يا
several
زلمة
minutes.
شو كتير بعده واضح.
What, sorry? Gregory, you asked me
Yes.
something? Did you ask me something?
Hello, doctor.
Hello, hello.
No, no. I was saying hello.
Okay. So let's wait several minutes to others and we can start, okay?
Okay.
Doctor, in this lecture, the CBL, you will explain a new lesson or what we will do?
اه.
Students, are you here?
Yes.
So,
Yes, doctor.
um, as I already explained, on Friday, the topics that I explained to you, you have to explain it today. Are you ready for that?
It's our turn to re-explain.
Yeah.
Yes, we are ready. This is the concept of the CBL.
Yeah. Yeah. According cases, I'll give you as soon as others will join us. Okay.
Okay.
So
We will
please
be
write.
answering the questions you sent.
I'll give you cases and let's see how we'll manage that. Okay, so guys, can you just help me and just say how can I, for example, share? I want to share you some Word file, and you have to work in that Word file. So, or I can just, for example, send you according our email, and then the student will share, and he or she will manage, and he or she will write down everything that we need. What do you prefer? To send you on email? Because I don't know how to share that. Um, Guys,
Yes, doctor.
what do you prefer? To share this Word file? But I don't know how to share in such a way that, after my sharing of my screen, how if there is possibility to add something from your side. Maybe this function is not having Google Meet, yeah? So for this reason, I will send you on email. Please write down now and chat your email, please.
You mean, doctor, the word you send on WhatsApp?
I will send you, no, 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 not this word. Send me now your email. I should give you now task. And let's see how did you prepare our topic.
Okay.
So first of all, I want to inform you that all of you should switch on your camera. I will explain what the concept of this CBL lecture. Please switch on, as I already explained last time. You have to.
Yes, doctor, but please, if the voice is too low, we can't hear it clearly.
Still same problem?
Yes, and also
Now?
Reem has the same problem. She mentioned that in the comments.
Who? Let me check it. Reem, can you hear me now? Reem. Reem Ahmed Al Baudli. Can you hear me?
Yes, doctor, I can hear you.
My voice is now more clear or not?
Yes, yes, it's clear.
Okay, so now please switch on your cameras now directly. I'm waiting for.
Just 1 second, I am fixing my camera.
Okay. I'm waiting also to others, please, students. Girls, I'm waiting for you. Rim Ahmed Albaoğlu, Yosef, Hussein, Rim, Majid Boujaber, Marila Hisham Slidey. Please switch on your cameras. Thank you.
Doctor, I switched my camera on from my telephone because my camera on the laptop is not working.
Okay, great. This is, guys, now I will send to one of your friends, Hashal, whose email is this one? Wait a second. First time he just sent it. Look. I send it to you.
يلا كلكم صوروني.
To this person, I'll say that. Okay. Whose email is it? Please say. Whose email is it? Hussein. Can you switch on your camera and also your voice?
Yes, doctor.
Hussein, I send it to you, and please now share screen. Share screen, and let's discuss what are we doing. What are we doing? So first of all, please switch on your cameras.
Okay.
Hussein, can you share?
Is it working, doctor?
No, it's not working. We can't see.
Now,
Yeah. Can you just go more up? It's a first page, yeah? First page. Show us, please, first page.
doctor, I'm using my telephone.
So, because
My
this
phone.
maybe,
My phone.
can you send to other, because of we want to show it in
سام بعت لي
video.
Okay, I will send it for Yusuf.
Send it to Isam, please.
Okay, please.
أبو عصام.
Doctor, I want to go drink water and come back.
Okay. Yosef, what is your email here? Did you send it? And please share in your group. We are having here our group in WhatsApp. Wait a second. I sent it there. I've forgotten that we are having group in WhatsApp.
Yes, doctor, I've sent it for Yusuf.
Yeah. Now even I'll send it in your group, and for all of you will be. Please check attached file. Can't we zoom more? What do you think? Okay, it's better. It's better. Enable editing, just push here, please, because we have to write down there.
Okay.
So first of all, I want to just Yosef, we can't see you. Sorry. Yeah, we are having two window here, so that's why. Did you read that information that I gave?
Yes.
So everything
Sure.
was clear for you?
Yes. If you want, I can fill it with my information if you want.
No, it will be revealed. So CBL, the main point here that we are making CBL is that we have to work together, okay?
Yes.
In this case, I will be tutor, I will give you such kind of hints and meanings. For example, what we have tend to apps or so on and so on. And you are helping in this case with me to explain even what kind of case and condition are we having. So students, now, can you please, I can't see Yosef know anything, it's just blank. What about other students? Can you check? Can you see that?
I will fix it.
From my side,
Yes,
it's
it is blank.
Yeah, it's blank.
Wait.
This is this one that I sent first time. This is
Black Lives
dental
Matter.
history. This is patient's dental history. Can you please remind me and say, please?
Now, is it working?
Alexia, can you please pay attention, please? Sorry, but you have to be with us. Okay, so this is dental history that we are applying and we are filling as soon as patient enters the dental clinic, okay? So can you please remind me and say how many parts are we having just when we are talking about patient dental history? Because it was written in your book. How many parts are we having? Let's start from the beginning. When it's written here, patient's name, gender, date of birth, and such kind of information, what do we refer it?
Demographic.
Demographic? Yeah, how we refer it? Please, one by one, okay? Because I have to even check who knows and which information is, for example, clear for you. So, this we are referring what?
Information gathering.
Information of what?
Gathering.
Information gathering, just generally, we are gathering information, but what do we refer that part of dental history?
Demographic data.
Patient's history.
Data. Yeah, this is demographic data. In demographic data, we are just mentioning what is patient.
The name and address, email.
Name, address, email, ID number, workplace, and so on and so on, okay? Allergy. What does it mean? Here, let's define, okay? Let's start from the beginning. Who will start to define me what kind of, here I think everything is clear, but then it's coming allergy, okay? Allergic reactions toward anesthetic solutions. What should we should write down? If patient knows, yeah, exactly, say something, explain me this dental history step by step, and then let's discuss case.
Allergic reactions toward anesthetic solution, you mean?
Yeah. Here should be mentioned toward the anesthetic solution, patient is having allergic reactions. Then it's coming what? Read one by one, just discuss it.
Okay, the already past and the present illness and the number of insurance, you mean to read this?
Yeah, but wait a second. Here, already past and present illnesses. What do you think? What we have to write down here?
The present illness, you mean the chief complement?
Present illnesses here on this first page, because present illnesses, we are just talking about the general condition of patient's problems, okay? What kind of general problem patient is having, like this systemic diseases should be discussed here in this branch. For example, if it's diabetes, if it's, for example, cardiovascular.
You mean the oral health history?
No. This first stage, we are collecting anamnesis about patient oral health, okay? First, what Hussein?
Hypertension and diabetes.
Yeah, diabetes or general condition patient, if patient is, if it's having, he or she is having, okay? So it depends on. And down, we are just referring what? Continue reading and explain it to me. Try to discuss together.
The next page or the next paragraph is about the date, the complaint.
Yeah, but before complaint, what is written? Patient's examination paper. Already
yes.
From this part, we are starting to check up what kind of condition patient is having, okay? So
yes.
Let's start from the beginning. Date. When patient came to the clinic, yeah? Then. What is coming then? Binis. Okay,
the complaint affected teeth is the main cause or the main reason that
The pain, maybe.
Yeah, what is chief complaint? Girls, Alexa, can you help me? Alexi.
It is the main reason why the patient went to the dentist.
Yes.
Exactly. What do we refer? Alex, what do we refer? It's a second name. What is a chief complaint, and what's the second name? How can we also refer?
Chief concern.
Chief concern. Exactly. So then down is coming was in this chief complaint, just when it's written, we are just saying, oh, patient is having, for example, irradiated pain, or if patient is having dull type of pain, okay? But when down is written, affected teeth, in this case, we are writing down exact number of tools that is infected already. Is it clear? No, yes. This one. Remove, and then I'll help you. Okay, remove this. Notice. Affected teeth means exactly you have to write down that teeth that patient have problem. Okay, and I'll give you a case, and we will do according that case. Okay, down. What is coming down?
Positive pain caused by irritant factor. Pain during the.
So now here, as you can see, it's mentioned several sentences where is written that, for example, if
several options.
Several options. Yeah, please read each of them and let's discuss.
Okay. Causative pain caused by irritant factor. Pain during tooth-to-tooth contact.
So what
We
does
have
this first sentence means? What do you think? What does this first sentence means? Causative pain means that, for example, patient is drinking something hot, cold, or something sweet. He or she is
or
eating,
when
and
his tooth,
after that, patient have such kind of pain. Yeah, this is causative pain. Then its coming was what? Pain. Please
pain
help me.
during tooth-to-tooth factor, for example, while chewing or while sleeping.
Exactly. Down. What's happening? Dull pain.
Dull pain, I have no idea.
It is
Dull
chronic
pain.
pain.
What kind? Sorry, Alex. Alexa.
It's chronic pain. It's like
It's mostly such
when
kind
it's
of
consistent, like it doesn't go away.
yeah, just during daytime, patient is sitting in something dull, just pain is having during this time, okay? So, and mostly such kind of dull pain we are having when patient is having periodontitis, apical periodontitis, okay? Then down, what is happening? Sarah, can you just continue reading? Please, guys, students,
Okay.
participate. Please, all of you should take place. Should participate,
So the
sorry.
next one is pain caused without irritant factor.
Mm-hmm.
This means that there's nothing specific that's causing the pain. It's there
Exactly.
without any irritation.
Okay, then
Do I
continue,
continue?
please, Sarah. Yeah, please.
Okay, night pain. It means the pain is at its optimum during the night.
Yeah.
Aesthetic discomfort. It looks ugly. It's not something they like to see.
So maybe a fractured restoration or something. Yeah, we are having defect.
Or change in color.
Or for example, it fractured. I don't know. Just depends on case. Defect of
Okay, the next
restoration.
one. Defect of
Yeah.
restoration.
Yeah.
So after doing the treatment, something's wrong with the restoration that was done.
Yeah, exactly. Then
Defect of
continue,
crown.
please. Defect of crown.
It may also be a discomfort, defect of crown, because it
Okay.
will look bad.
Mm-hmm.
Root. Maybe it's root pain.
Not root pain. It's because of if, for example, we can see only root in oral cavity, okay, and the coronal portion of the tooth structure is damaged.
Root canal treatment.
No. Root canal treatment, no. Yeah. So if it's left on root canal treatment, it should be evaluated. But in this case, they just mean that if it's written root, just it's left into oral cavity root. So then continue, Sarah.
Facial asymmetry. This is outside the oral cavity.
For example, if one side of the lip is upper.
Yeah, what do we refer? What do you think? How are we checking and which paragraph was there that we are checking patient gait, patient facial asymmetry? What we are referring this examination method?
External
Physical
examination.
exam.
Yeah,
Physical examination. Thanks. Then continue, please.
Okay, presence of biofilm and calculus.
Yeah, what does it mean? What is biofilm and
Biofilm is
Yeah.
the plaque.
dental plaque? Yeah. What I explained previous week. How are we detecting this?
We can use the dye.
Exactly. Then what's
Okay,
happening?
next, bleeding from gingiva. It may result from the inflammation of the gingiva.
What do we refer this condition? Inflammation of gingiva. How can we? Gingivitis.
Yes.
Okay.
So,
Adentia.
what is adentia?
There is no teeth, loss of teeth.
What? Sorry.
Loss of teeth.
When in alveolar arch, yeah, it's our tooth is missed. But adentia, do you know what kind of condition is it? That into jaw, inside the jaw, we are not having tooth germ. It missed.
It doesn't
Because of some problem.
It means
exactly. During gestation period, that tooth does not develop. So down, what's happening?
Halitosis. I'm not sure what this is.
Who have any idea about halitosis? Oral malodor and halitosis, it's same. Who can say? Marilyn, can you help us? Or Joe? Joe, can you answer? Or
Yes, it's a bad smell, bad odor.
yeah, bad odor from oral cavity. Yeah. What do you think? In which case are we having bad odor from oral cavity?
From
Stomach, from the intestine. or
Yes.
something.
From digestive, only from digestive tract?
Yeah.
Maybe bacteria.
from caries.
Or in the mouth, from bacteria in the mouth.
From bacteria.
From bacteria?
Focus.
No, we have many cases. For example, for people who had the crown or veneers, and the underlying teeth is affected or is have caries, it will make a bad smell.
So only the
And
so
when
sorry.
you remove a tooth during surgery.
During surgery, what else? Which problems even can lead? Digestive tract. When we are having what? Sorry, Sarah.
Food accumulation.
Bad flossing.
So what do you think, Sarah? Yeah, bed flossing, good.
Dental plaque.
Dental what? Dental plaque.
Plaque
Exactly.
also give bad smells.
Yeah. So
Due to
when
the bacteria.
Sarah mentioned the accumulation of food, what do you think, Sarah? In which cases food starts accumulation? Let's think logically.
Let's say when there are spaces between the teeth, increased
Or we are having what?
erosion of the enamel.
What is malocclusion, guys? What is malocclusion?
Okay. So when they close the mouth, when they bite.
Yeah,
When
and
they
when
the
the
two dental
teeth,
arches are
yeah, when the teeth are not in one line, okay?
Yes,
When the teeth are not in one line and we are having overcrowded teeth, when we are having overcrowded teeth, sometimes because of their changing positions, food stacks between teeth, okay? So that's why these problems can lead. What else? What else? The most famous disease that is, for example, that the whole world is suffering. It's one of the most causative factor. What is it? Just help me. I'll say, but I want just from your side to from your side to know it.
poor oral hygiene, gum disease, gingivitis.
Gingivitis. So all of these are periodontal disease. Oh yeah. So what else? What else? Caries, decay.
Yes, I already mentioned caries in the first. But
Really sorry, I can't.
Quantities.
I told you caries.
So sorry, I can't. I don't know, but I did not hear it.
don't worry,
Okay,
don't worry.
so caries, periodontal disease, digestive tract. Okay, so if patient is having halitosis, what do you think? How we are just treating this condition?
We solve the problem. Let's say caries. We detect the degree of severity and we start treating them. If it's
Yeah.
not the problem or digestive tract problem.
Yeah, now look at what's happening in this case. We are having problem in oral cavity and in digestive tract. Yeah, we have to differentiate. This problem is coming only from oral cavity or from digestive tract. So how are we differentiating? Of course, we are trying to improve patients' oral health. We are trying to help. And after that, as soon as we will fix all the problems in oral cavity, then already we are thinking about to address patient to another doctor to treat any problems that patient is having in digestive tract. So, and the last sentence, please, Sarah, and then other
Okay,
students.
so the last one is pathology of temporomandibular joint. There are problems in the temporomandibular joint that can be muscular or
How are we examining this temporomandibular joint?
I didn't listen to the question.
How are we examining TMG problems, if you know?
By doing X-rays.
X-rays, but I mean clinical examination, just at clinic, at dental chair. How are we examining?
We check the occlusion of the mouth.
What else? If there is clicking sound in TMG region, it is indicated there is problem. Even during this time, we are palpating from outside and we are checking how this TMG looks like in joint. So then, what is now the second one? Wait a second. Reem, can you help us and continue reading?
Yeah, anamnesis.
What does it mean?
Let me check it on Google.
I don't know.
It is the medical history of the patient after the doctor has asking him so many questions.
Yeah.
The patient's account.
This is anamnesis. When we are just collecting anamnesis means when we are asking questions and we are just getting information about patient's condition, okay? Yeah, so down, what's happening? Can you continue, please?
Okay. Objective examination, checkup of oral cavity, localization.
Okay, so now please answer. Do you know and have you any opinion about
Yes.
Hughes nomenclature?
Yes. We divide the oral cavity into 4 quadrants. And we start.
Yosef, it's here. Hussein, can you, if you know this information, can you say?
Yes, doctor.
Okay, what is it?
We divide.
And please say quadrants.
We divide the mouth into 4 quadrants. Yes, we start counting from the central incisor is the first one.
Now divide it into quadrants and say name of these quadrants. How are we dividing?
1, 2, 3, 4. Start from the start like this. 1, 2, 3, 4.
Show me on your face.
1, 2, 3, 4.
3, 4. This is in adults. What's happening in children? With children?
In children's, we start counting in different way because in children's they're not 16, 5 only.
Okay, but how? How are we dividing quadrants? Sarah, can you answer?
Also the same into 4.
Just 1, 2, 3, 4 quadrants. Are we having same?
No, for children we only have two upper and lower.
No. Sarah, what's your opinion? How are we dividing quadrants in deciduous dentition? Alexa.
What's the question?
That's why you have to listen. I should not ask so many times.
So you mean like it's 4 quadrants and we start from the right, from the upper right? Which 1, 2, 3, right? Or no?
Yeah, but in deciduous dentition, I'm asking deciduous dentition.
Into right and left, like as a mid-sagittal plane?
No. Reem.
Doctor, may I?
Okay, Yosef, say.
We divide the type of the teeth. For example, the central incisors, the lateral incisors, the canines, the first molars and the second molars.
Then?
For example,
quadrants, same quadrants that you, for example, divided in permanent dentition.
yes.
You mentioned it. We are having 4 quadrants, yeah? This
yes.
is 1, 4, 1, 2, 3,
1, 2,
4,
3,
yeah?
4.
What's happening in primary dentition? Joe, can you help us?
Yes, sorry, I had connection problem.
Okay, Joe, our question is about this. This is dentition. We already know maxillary and mandibular
Yes.
jaw, but here is mentioned that is in permanent dentition we are just discussing, but your friend already
The
is
deciduous
how
teeth are primary.
yeah.
The
So
small ones.
so
Yes,
in
they are. They are
dentition,
in total. They are in total 20 teeth, and they are divided 5 in each quadrant.
so what are the numbers of these quadrants?
Some people call them with A, B, C. I prefer with 5, 1, 5, 2, 5, 3.
Okay, so divide quadrants. Say 5, 6, 7, and 8. Is
They
it clear?
continue after 1, 2, 3, 4.
Look, students, how it is, for example, in permanent dentition, 1, 2, 3, 4. Same is happening in permanent and primary dentition, sorry.
Yes.
5, 6, 7, and 8. Clear?
We replace 1 by 5
By
and 2
by
by
5.
6,
Yeah,
2
by
by
5,
6.
2 by 6, 3 by
3 by 7,
7,
and 4
and
by 8.
exactly.
But some of them use the letters A, B, C, D for the deciduous teeth.
We can
But
use,
usually you use 5, 1.
most common, and nowadays the most famous one is when if you'll say first, if you'll divide quadrants in permanent dentition one, it's up to you, Sarah. No one will say that it's not correct or it's not incorrect, okay? But it's up to us. But the most famous one is when we are dividing quadrants in permanent dentition and primary dentition in such a way, okay? So here, as soon as we will reach this part, we have to write down here how many caries patient is having,
and which number?
Which
and
numbers,
identify that.
where is pulpities, what is where is filling materials, where is artificial crown, extracted teeth, and adentia. Okay, we have to
Doctor,
write
there
down.
are digital evaluation for these things.
Yeah,
Yes.
digital, but in this case, let's have like this because I could not find this digital one. Okay, now down. Alexa will continue reading.
Occlusion.
Occlusion. Should I say what it is?
Yes.
I don't know. Is it when our teeth is just like closed and that's the occlusion or what?
What is occlusion?
Occlusion is the surface of the teeth.
When maxillary and mandibular jaw
Contact between the maxillary and mandibular teeth.
When they contact to each other.
On
Yeah.
When they contact.
occlusal plane. On occlusal plane.
Yeah.
Depends on what type of occlusion are we having. It's direct protrusion, or what kind of occlusion are we having, or open occlusion. So it depends on.
But doctor, what we can write in this?
You are checking occlusion. What type of occlusion patient will have? Patient may have open occlusion, so it can be, for example.
It's not related to type 3 bite, type 1 and type 2.
Yeah, as you wish. Even this classification you can use in this case.
Oh, okay.
Condition of oral mucosa. What? Sorry, Sarah.
Should we also include the angle difference?
Angle difference?
About angle difference between the contact
of
the maxillary.
It must be 120 degrees.
Yeah. It will be better if you mention here. What about the condition of oral mucosa? Continue.
We write good or bad?
No.
Is there any problems in it, bleeding or
inflamed?
Yeah.
Inflammation or bleeding or.
If there is swelling, if mucous membrane looks like reddish, because normally we know that it should be pink.
Or if there are any ulcers or
ulcers or any kind of morphological
or herbs.
like erosion or traumatic injuries. It depends.
Yeah.
So then.
Condition of periodontal disease.
Yeah. What's happening now? We are just assessing now periodontal problems. Okay. So what are we doing?
We have the swollen when we have the enlargement of the tissue, and we have
no. Hypertrophic is enlargement, but swollen is different. What's the meaning of swollen?
Swollen is when something is damaged and they gather شو اسمه now the erythmos they gather on each other and they will lead for this swollen area.
Joe, you are not agreeing, as I can see.
Yes.
Say your opinion.
What?
Say your opinion.
I think that swollen is when the place that is damaged, it becomes like what Yusuf said, but becomes
inflamed.
It forms like a bulb, like a.
It can be like an abscess when an abscess like swollen. It can be.
No.
It will be when the place where it's damaged it becomes enlarged.
When the gum become red instead of pink.
Red. Yeah, become red. Our gingiva in this case become more red because inside we see that it's inflamed. Yosef, why did you switch it off?
By mistake.
Okay. I'll show you swollen gingiva, how it looks like, if it's possible. But
I can show you.
Okay, show us. Yeah, swollen gingiva, how it looks like.
Wow. Just 1 second.
يلا صار صوريني يلا.
In English.
Stop joking, Joey. These bubbles and balls represent the swollen gingiva.
This one is, yeah.
No, doctor, is it a result of poor hygiene?
Yeah, for sure. But it can be result. There can be many etiological.
Sometimes it is due for a punch, due to a punch.
Yeah, but mostly it comes because of this is plaque induced. It can be plaque induced gingivitis and also other factors, hormonal disbalance, and so on and so on. Okay, let's share.
The treatments are always surgery or it can be the treatment of the swollen. Hello. Hi.
Yeah, sir. Let's go.
I'm asking about the treatment of the of swollen case.
What's your opinion? Just let's say.
I'm asking if we had, for example, a patient who is suffering from a swollen periodontal disease. The treatment would.
I understand your question, but I'm
the treatment.
If others have any opinion about.
Okay, sorry.
Who can answer?
Maybe by brushing our teeth better, if it is a tooth infection.
What else?
You mean improving dental hygiene?
Yeah, for sure, it needs improvement of oral hygiene.
It's because of
dental hygiene is in the long run.
The poor dental hygiene.
What do you think?
Using antibiotics.
What do you think? Directly, you can treat condition while you don't know diagnosis of condition? Can you directly start treatment if you don't know from where the problem is coming?
No.
So
Surely no.
Check its origin.
So you have to find what the problem is. It's plaque induced problem. This is hormonal because of hormonal disbalance, or it's because it can be local and it can be caused by overhanging filling or crowns or so on and so on. So from the beginning, we have to diagnose what kind of condition are we having, and after
First
that,
of all, diagnose, and after that, we have a treat
yeah, we are treating
plan for
condition.
the treatment.
But of course, if it's caused because of plaque-induced, it's plaque-induced, for example, gingivitis, for sure, we are suggesting and say that patient should improve oral hygiene. Then,
Who's next?
so next, I told you, Alex, you have to continue.
Wait,
By the way, I'm writing points. By the way, I'm writing points in it, so
It is graded this lecture.
it's graded.
Okay.
I said hyperemia, so it is excess of blood, I think, or not? Can you hear me?
I don't know. Ask your friends.
It can be excess of blood in the blood vessels, which look like red and
it becomes the gingiva become easily bleeding.
Yeah, please don't ask me. Ask your friends. As you can see, your friends already knows information about that. So ask your friends. Continue. And if it's false, if it would be correct, I will
Hyperemia
from my
is
side.
the increase of the volume of blood.
That's because there is an increased volume of blood, so we can see more red, maybe in the gingiva.
Redness is due to the increase of volume of the blood and the diluted vessels, dilated vessels.
yes, it look like red and warm.
Okay, continue.
Hypertrophic bleeding. I don't know what that is. I think it is just excessive bleeding. Maybe.
What is it? Discuss among you. What is hypertrophic condition?
Hypertrophic is also when the crown it becomes to overgrow. Right?
Yeah, exactly.
Cancer?
Not only cancer. Sometimes when there is some kind of
it may be malignant.
Malignant condition even can be caused such kind of increasing of this gingival structure, or it doesn't matter, but mostly when we are having such kind of condition, I'm talking about now gingiva when a patient is having such kind of hormonal disbalance. I mean, during puberty period, during pregnancy period, when such kind of persons are having hormonal disbalance, the gingiva are growing in size, and we are having according that grades of this conditions. Okay, so continue.
Type of biofilm. This means it's not noticed.
Bleeding?
It is like microorganisms in different places. Yeah, many microorganisms in different places.
So sorry, I have to translate this. This is supragingival and subgingival biofilm and tartar is discussed here.
This
Maybe
one?
I missed. Yeah.
I can translate it. Just 1 second.
Supragingival, or maybe it's written. Let's check it down.
I'll check.
What do you mean by this word, doctor?
She means the types of
supragingival types of biofilm. It can
types
be
of biofilm.
subgingival and supragingival plaque and biofilm.
It is gingival.
Supragingival.
One of them is sub and the other
above gingiva, and subgingival means
Supragingiva above.
Supra is above and sub is beneath.
Yeah. Above and below the gum line.
Joseph, can you add supragingival?
Yes, surely. Supragingival is when it is up, and top is when it's down.
Yeah, sub is down. So, continue.
Yes,
Alexa.
me? Okay.
Alexa. And then Marilyn will join.
Yes. Doctor, it's my turn.
Sarah, can you say what is bony pocket if you know?
Yes, where the teeth lie, like the alveolar bone.
Guys, just wait a second, please. Every time there is no necessity just to ask, just say, all of you should participate. I already told you I'm evaluating your participation. So as soon as you know information about something, you should participate. Otherwise, it will decrease your points. So by the way, take into consideration.
But Doctor, I'm not hearing you well. Please, can you increase your voice?
Now it's clear?
Yes.
So you should participate because in your participation, I'm writing points. So
it's not in turn.
What? Sorry.
It's not in turn. I mean, if Sarah is talking, I wait her till she finishes.
Yeah, you are waiting, but just you should discuss among you, okay?
Yes, yeah.
And please discuss among you, and let's if it will be, for example, incorrect thing, I will add and I will say. Okay, continue, Sarah.
So bony pocket is right.
Bony pocket can be like gingival sulcus.
No. Other opinions?
Bony pocket, maybe when the teeth go upward.
Is it the underlying bone?
No, Joe, what's your opinion?
Doctor, when the bone is void,
When the alveolar bone surrounds the tooth, it forms a pocket.
It's around the tooth, but it's higher than usual.
No, just bony pocket. Why bony pocket? We are having not bony pocket season. So why?
Doctor, it can be from disease like periodontal disease and
Yeah, for sure, it's coming from periodontal disease.
Yes, it is a type of periodontal disease.
and lead like a problem in the bone and.
Okay, I will say now with a few words. So bony pocket, this indicates that when we are having periodontal troubles, resorption of bone structure is starting into two ways. This is vertical and horizontal resorptions we are having. Bony pocket is developing as soon as we are having vertical resorption. I'll show you now. Or Yosef, if you are sharing screen, and can you just find information about bony
Search for what? Bony pocket?
Bony pocket on X-ray, and I'll show you how it looks like.
Okay. Bony pocket on X-rays. Okay.
Then we will continue, and Marilyn also.
Okay.
They have to explain.
Okay. Hi, Joey. If you can see this.
Not this one. This next one. On
This one.
X-ray. Next X-ray. This one. This condition. No. Molars. Between molars. Between molars. Can you see? Wait a second. I'll share. Can you see this condition here?
Okay.
As you can see, we are having here vertical resorption. So in this case, appearing bony pocket. But when we are having horizontal, wait a second, resorption, we are having cutting triangles, horizontal.
Does it happen between the roots?
Wait, I'll show you. Horizontal resorption of resorption.
is when the gum recedes to itself.
Yeah, right. For example, let's take here, okay? As you can see, bone that we are having between two teeth. Look at this. Even this bone, like our gingiva is having, it should have triangle shape. As soon as we are having as soon as starting horizontal resorption starts from here. That's why we are having here cut triangles. It should have triangle shape.
Which is more aggressive, the one you showed us first or this one?
Both of them depends on severity of condition, and
this is normal.
Yes. This one is this case. It seems to be normal.
Yeah, but I'm asking. Look, when it's cutting, it should be more pointed here. It should be more pointed. Wait a second. More good visuals. For example, here is starting problem. Look, it should have more big triangles here. I'm asking, what's it here? It should have
Equilateral triangle.
triangle shape, but it's cutting. As you can see, it's damaged.
Doctor, those white spots are due to the restoration of the.
Yeah. This is post restoration.
Okay.
But nowadays we are not.
Bravo, Islam.
Vertical resorption.
What, Sarah?
The example you just showed us is vertical resorption.
I can hear you.
Hi.
Yeah.
Okay. So the example you just showed us, it's vertical resorption. The one where the triangle doesn't appear.
No. This is horizontal one. The vertical that I showed you when we discussed bony pocket.
Okay.
So rim.
Which rim? We have two rims.
So who did not participate? Marilyn, okay, because I can see.
Okay. Atrophy of alveolar bone, that means when it's during the tooth eruption, which undergo atrophy with the tooth loss.
Yes, exactly.
Can it be due to a hit or a trauma?
Atrophy, you mean?
Loss of the alveolar bone, yes.
What kind
because
of trauma do you mean?
If someone punched someone in the face and he lost his tooth, that means he lost his tooth. So there is atrophy of alveolar bone.
Yeah, it's correct. Marilyn, continue.
Okay.
If you, for example, answer, so.
Periodontal pocket, it is when we have like a gum inflammation, which it causes the pockets to develop between the gums and teeth. That will also fill with the plaque and bacteria. And the pockets, they will become deeper.
Sorry for turning off, but electricity went.
Fatima, can you continue? As soon as Yosef will switch.
Just 1 second, because the electricity went off and in Lebanon.
Doctor,
Doctor,
at 2 p.m. in Lebanon, there's always a loss of electricity.
Why?
It is scheduled like that.
2 and 6 p.m.
Is it working right now?
Yes.
Yes.
Now it's already 3 o'clock, so.
Yeah, but
No, we are before you by 1 hour.
Okay.
Yes. Whose turn to start reading?
Only Alexia. She is 11 p.m.
Yes, she's in Australia.
Fatima, please. We can't hear you.
I can't hear her either.
Periodontal pocket?
Depth of periodontal pocket, yeah.
I don't know exactly what does it mean.
Discuss. What are you waiting for? Discuss.
Yes, the periodontal pocket. Are you hearing me?
Yes, yes. Now we hear you, but there was a problem in your voice. The
Oh, okay.
periodontal pocket,
It's the absence of skin around the tooth.
the gum.
The gum, yes.
It is due
More
to
exact, how can I, for example, describe it?
it is the coronal movement of the gingival margin.
Yeah, or loss of
How are we
attachment.
measuring depth of periodontal pocket?
By using
The gingival complex is altered.
we measure the
By
depth
using a
of
groove.
by using the brew that you showed us last session.
Yes, the millimeters. It must be.
It is numbered 1, 2, 3, 4, and at 5 it is a black pocket. And we measure it by narrowing it, not putting it straight.
Okay.
Yes, you told us it must not be parallel. It
Yes.
must be.
Okay. Someone should switch.
Ay, dainte, my ear.
So continue, Fatima.
Depth of periodontal pocket that is examined by the instrument they talked about, and the plan of examination to collect anamnesis and to
So
check.
what we did in this case, we are just writing down, for example, what we did and what kind of additional methods we used. It was radiographic examination, biological test, allergic test. We are just collecting anamnesis, not collecting anamnesis, what we used to collect anamnesis. We are writing down everything here, okay?
Yes.
From where is coming this sound?
Plan
Okay, continue. Continue, Fatima.
Okay, allergic test, the consolation result after checkups. Result after
Mariam,
checkups.
okay, just so then.
What happened after the first checkup with the doctor?
What is panoramic X-ray and what are the types of X-rays? Hussein, can you answer?
Oh, panoramic.
Types of X-rays.
Yes.
We have panoramic. We have PCB also.
We have the periapical.
Hussein, I can hear. Hussein will answer, and after that, Joe and Sarah wants to. Hussein, switch on camera. Okay, Sarah, answer. Sarah, answer.
So we have the panoramic, which is frequently used. We have the used mandible.
Sarah, I can't hear you.
Your voice is not clear.
It's not clear.
Okay, so we have the panoramic, which is mostly used, the most common one. We have the which is for a specific number of teeth. It's just for maximum. We have the occlusive. And what else did I say?
Periapical.
Yeah, I said periapical, occlusal, panoramic.
And
the one that shows the surfaces.
Can you add Joe?
Interproximal.
Interproximal, yeah.
And?
Interproximal is the last one, or the
Interproximal and CT scan.
yes, CT scan.
MRI, CT.
So, continue.
Who wants to continue?
The CBCT also.
Panoramic. Electro.
Electrodiameter. What is it?
Electrodontodiameter.
Don't search, Joe.
What?
What is electro-odontodiameter? Yusuf, you're looking for a lady, really? Come on.
Looking for what?
Yes, you are searching.
No, I'm not.
Okay. What is electro-odontodiameter? So write down. You have to find what is this and.
Does it show the?
Write down what?
The size of the tooth? I don't know.
No. Write down and find this information. What is it? What is apex locator?
Apex locator, right?
The apex of the tooth.
It is a machine that is a X-ray that locates the apex where it is, the location of the apex.
The length of the tooth until the apex.
Doctor, I know it because my father has it. It shows you the root length, the root canal length, especially.
Is it informative? What do you think, or X-ray is more? Which one is more informative? What do you think for us? The main point here, then, where are you using apex locator?
It depends on what
depends on
the case. We have.
Depends on what we're
doing. If you're working on the Dontex or
we are measuring apex locator. We are using when we want to measure lengths. Yeah, working lengths in root canal.
Yes.
Yes, doctor, you can't measure length by using X-rays.
Yes, X-rays they don't.
But I'm saying which one is more reliable method?
Apex locator.
Is more accurate.
Apex locator if you want to see length.
This is accurate measures.
Yeah, exactly.
It's like using a ruler, and the other one is like using a photo.
Yes, exactly.
What is RBG?
RBG, it's a rocket RBG.
What's that?
We don't know.
This is radiovisiograph.
No idea about it.
Apical X-ray, when we are just checking maximum 2 and 3 T's we are having, we may have into two options. We can, for example, after taking X-ray, we can, for example, see this X-ray on films. But second option is LVG. This means that we can see or hold information on monitor. Continue.
Yes.
Come on.
Who wants to continue?
Just read
I will continue. Okay. CT scan, and we have the allergic test.
Down.
Hello.
Yes.
Continue.
Sorry, but the connection problem. Consultation result after check-up.
What is it? What kind of information should we write down there?
What we found out during the physical examination.
Physical and clinical examination. Then?
Yes. And we have the final diagnosis, ICD-10.
With its codes. What is our diagnosis? And we are writing down with its code.
And now it's the time for the treatment.
What we are going to do.
The treatment.
Yeah, what we did. Yeah, what kind of treatment we did. For example, we opened pulp chamber or we obturated root canals and restoration. We are writing down everything into details. This is correct for next appointments.
The next appointment, when I am free, I will give him an appointment.
Date, anamnesis, status, diagnosis, applied treatment, and prescription should be written there, and the dentist's signature should be signed in that gap. Down? No, don't feel, please. So down.
The result of the treatment, or this is the prognosis.
Yeah.
After each checkup.
So down.
On the next visit.
And this is the advice, the prescription, when we prescribe medications.
Yeah, and
Eat candy to come back.
Where?
Patients informed written paper to provide dental care.
Now let's start from the beginning and discuss case. I'm not helping in this case, okay? Go up.
Okay.
Open.
We will create our own case, or you will
No. You are
put a
having
case.
this case.
The doctor sent us cases.
In WhatsApp, so open and let's check how we will do.
1 second to open WhatsApp
If
web.
you can't do, no points will be then, so
No, we will do it.
you will do it. Okay, I'm waiting.
We are the best.
Doctor, how many times have you filled this patient?
How many times?
How many?
Maximum you need maybe 10 minutes. Just I mean clinical examination, but this first demographic data and diagnosis, we are filling them later.
Yes.
Or from the not later, sorry, from the beginning. As soon as patient enters the clinic and while he or she will sit at our dental chair, we are filling this demographic data and for this first page. Second and third pages are for us to fill what we found in oral cavity. And the last page, of course, signature is as soon as we will finish our procedure. Okay. Start discussion and write down and
discuss it.
Yeah. I didn't wrote here, for example, ID number. Just write down. I think it's
a group work.
So start.
Okay. A patient is 20 years old, male. Chief complement was swelling on the upper maxillary jaw region. After a clinical examination, one precaution was applied.
Second quadrant.
Yes. We can start, or you are still reading?
No, stop. No, I don't need it. You have to prepare it. And discuss among
Doctor, do we prepare it as a group?
Yeah.
Yes. I will read and they will help me by filling, and I will fill with them. And we will fill together. Patient is 20 years old. But they didn't mention his name.
Okay, that's why I told you this is personal information. I did not give you. Just write down some name.
Date of birth 20 years old. 1, 10.
Phone number.
Okay, just okay.
Gender is male. Gender is male. It's in the paragraph.
Yeah, gender was male.
Okay.
بلش منيح يوسف.
Tbilisi working place. Sharbini. Allergic reaction towards anesthetic solutions. He didn't.
Okay, wait a second. No. In this case, when it's written in your history, what kind of questions are you asking? And everything you should say.
We're gonna ask them if they have any allergy reaction to anything.
Yeah, so
against any anesthesia, against
which type of anesthetic solutions you know?
inhalation, intravenous.
No, anesthetic solution. Write down even this anesthetic solutions also. You have to read information about this.
Okay. Already past and present illness. They mentioned that he has.
Their history, if they have diabetes,
maybe have problems
So
like hypertension and
We'll put for him hypertension.
bleeding, and
We'll suggest this one.
we
you are
ask,
asking if patient knows that condition. You are asking what kind of complaint. Are you having any kind of general systemic diseases? And after that, you are filling this part.
Yes, but in the case they didn't mention any disorder or illness, so we are suggesting
for
one.
example, I gave you because next week I will bring more big case. Okay, we wanted to discuss today. That's why just for example I gave to you.
حطيتها في المايك من عنده.
What's happening down?
Someone is parasiting. ريم بعتقد.
بيطلع صوت منه.
Now it's better.
No, it's fine. Yes. So in this case, in this blank, we don't fill it because they didn't mention any illness.
Yeah.
The number of insurance.
If patient is having, for example, now let's start. So for us, more
random number
part is starting. Okay, we are filling this history with the help of the assist.
Yes.
Doctor is sitting and patient is filling this.
Yes, the most important one when we start patient examination paper. We want to fill out the date. After that, the complaint, affected teeth.
ده complaint دكتور. Swelling on upper maxillary region.
I thought they are together.
Swelling.
The complaint is swelling on the upper maxillary jaw region.
Reem, participate. Reem, Fatima.
Yes, feeling pain.
Affected.
And the affected teeth, they mentioned that the number 26.
26. Doctor, do we write 26 or we write third molar, second molar?
No, like this, like you wrote.
Okay. After that, we have many options. We have the cause of pain caused by irritant factor. We have the pain due to
case. Discuss it.
The case.
Irritant heat percussion. When percussion was applied.
We have a bleeding. We can put a bleeding here. They mentioned in the case that he suffers from bleeding from the gingiva, and here we have bleeding. We can take it.
But we can add
biofilm. Biofilm كمان. Ziter is a clinically revealed dental plaque يعني في biofilm and calculus.
بس
two.
How I can
حطهم highlight.
أو underline.
Okay. Doctor, I will highlight the answers we.
Okay.
No, not this one.
Jack بص highlight عليه.
Bleeding. شو واحد شو الثاني؟
في inflammation
presence of biofilm. في other كمان إذا في شيء
we have dental plaque يعني biofilm مثل ما قال جوي.
You can add
The presence of biofilm calculus.
Yusuf in the beginning
And we have
part that says when percussion was applied, so it's one of the irritants that occurred.
yes good one. ما نلاقيها
pain caused without irritant factor.
No.
Okay.
Causative pain by irritant factor.
Yes. Any other one?
Was there written like this?
What, doctor?
Percussion as an irritant.
Pain caused by irritant factor. Was it written like this?
No, it was written that percussion caused the pain.
عم تسمعوها؟
No.
Doctor?
Yeah.
They mentioned when percussion was applied, patient has had severe pain on the molar region.
Can we put dual pain or not?
So irritant thermal changes.
Pain during tooth-to-tooth contact, this one indicates this one. Is it clear? That sentence that you read, Yosef, indicates this one.
Yes.
I told you the first point was when you are drinking hot and cold water or something, you are eating something sweet.
Yes, or providing air compressor to see if it is sensitive.
So continue.
Can we also put Dr. Dull pain because he said he had severe pain on molar region?
No, dull pain is not severe pain. Severe pain is when patient is having terrible pain, and dull pain is, how should I say, just
persistent.
The volume of pain, just resistant pain that just is having. It's
Sarah?
not severe, okay? Dull is, you know what the word meaning of dull?
Yes.
So it's just bothering you, yeah, just that's all.
Yes.
Dull pain is different.
Okay. Then we are enough with those two options.
Sir, we don't mention percussion in any part of the.
What is this procedure, percussion?
When you press on it, isn't it that way?
Press. What do you mean press? Can you explain it more? It should be more clear.
Stimulated.
Pressure.
Not pressure.
Stimulated by.
We can do a cold test.
What? Sorry.
We can do cold test to see if there is a dental plaque.
This is the irritant factor. This is the irritant factor.
Yeah.
What I told you. What is percussion that we are applying? We are clicking on specific tooth.
Biting the tooth.
With the help of the probe, but always check up. We are starting from healthy tooth structure. From healthy tooth. Why? Because during this time, patient should distinguish what kind of pain patient is having when we are clicking on healthy tooth and what kind of pain patient is having as soon as we will click on infected tooth. So in this case, which one?
We can add it on the other.
Pain during tooth-to-tooth contact?
On the
exactly, Reem. Exactly.
Yeah.
Yes, percussion is tooth-to-tooth
contact.
But the patient didn't mention anything about contact.
You are missing even something. You are missing even something. So.
Which one? Inflammation. Root.
No.
Pain without irritant factor.
Doctor, can we say night pain?
No, it's not written that it's night pain. Is it written
Oh, so
there?
we don't put.
No, we don't have it.
The patient didn't say anything about irritant factor. Should we click the one that says pain without irritant factor?
No, irritant factor in this case I already defined and said irritant factor in this case we mean that, for example, if patient is drinking hot and cold,
yeah, I
understand.
understand.
But this one, when we are clicking, we are just doing by ourselves. But when, for example, drinking hot and cold and patient or eating something sweet, and patient have such kind of discomfort, this is this one.
Yeah, I'm saying about the one without irritant factor, not without.
Not without, yeah.
So we can say aesthetic discomfort because of dental plaque?
No.
Cause of swelling.
Aesthetic discomfort, you know what kind of condition is it? For example,
broken tooth.
We are having non-vital tooth. And that tooth color changed, and it does not have same color as adjacent tooth.
Yes.
In this case, we are saying, or for example, there is old filling material and already changed the color or something, okay? Aesthetic discomfort, we are saying like this.
But now we are done with those options because dull pain isn't present. Pain without irritant factor isn't present. Night isn't present. Adentia, the tooth is present. We can't say adentia. And no defect of the crown, no facial asymmetry.
Okay, continue.
Okay.
Next week I will bring you even X-rays, but now today I want to talk about what kind of information are you having, in which semester are you, and which subject did you pass. According to that, I want to make a case.
Okay.
Because of if I'll do case and if you can't understand, it's not clear. But this is one I just gave you just to introduce how we are feeling this history, to have any opinion. And what you studied, it will reveal here.
Yes, and we have the halitosis right here, right, and pathology of temporal mandibular joint.
It's not mentioned.
There are
سارة صوتك واطي.
That hypertension.
But they didn't mention any halitosis clues or pathology of temporomandibular joints in this case, right?
What was said about temporomandibular joint? From somewhere is coming voice. Please switch off your microphone.
ندور ميكروفون يا شباب.
What are you writing down in anamnesis? For example, patient is having 2-6 tooth. For example, there is swelling, everything, just 2-6 tooth, and the patient is having swelling on upper maxillary jaw region.
And bleeding from gingiva.
Yeah, it's bleeding from everything. You're writing down such kind of information there. What patient expressed and what patient said. And consultation is what you, for example, did for patient. That's to diagnose, okay? What you did, percussion or what you did.
Yes.
يلا يلا.
طبعا.
بدك تكتب bleeding.
Stop swelling on upper. Maxillary region, tooth 2-6.
Inflammation.
Doctor, so in this part we write almost everything.
Yeah, just bleeding from gingiva 2-6 tooth is complaint, and of course we have to write down what
the percussion.
And patient is having severe pain.
Upon percussion.
Yeah.
Okay.
Not percussion, not here percussion. Percussion we have to write down in consultation area.
Yes.
Okay.
Now move to the objective examination.
You have to write about the pain.
Now, objective examination already starting, so we are checking what?
زعلت كمان dental plaque.
Inflammation, dental plaque.
Okay. Objective examination. It is localized on the tooth 26, or it can be here, this one. You can see it, guys.
حطينا شوية plaque عليها.
This one.
This one is it, but next time I will give you, for example, X-ray, and you show me, for example, where is caries, where is endodontal treatment done, and everything,
Yeah.
teeth and everything, okay?
Okay.
It is MOD cavity or OD cavity or MO cavity. You have to.
Yes.
mention.
Doctor, these words are not clear.
I'll do it. Yeah. There is caries. Here is written what? Localization.
They are written in Georgian.
Caries. Yeah. I will, because I don't know, but I could not remove this.
شباب سؤال مش في سن ناقص على اليمين.
This part. So, how did it? Just deleted it?
Yes, I have my magic touch.
Magic touch. But here, there, you can write down. What do you think? Just try to write down there. No, you can't. Yeah.
I can't write here. Yes, I can.
Okay. So, down.
What? Tell me, and I will write.
No, I'll do. We will waste our time. There should be written caries, periodontal condition. I will fix it. Down.
Okay, next.
Occlusion.
Occlusion. As I guess,
we don't know anything about it.
Yeah.
You don't know about anything about occlusion, so we will skip, okay?
He didn't mention anything.
Neither.
Doctor, it is a physical test, yes?
Yes.
What, sorry?
Occlusion is usually physical test.
Physical examination.
I don't know. Wait a second. This
is
teeth examination.
clinical examination.
لا عم شارك يا حمار. Yes.
Mm.
And after that, we move to the condition of oral mucosa.
Bleeding.
Not only bleeding, Sarah,
Inflammation.
ulcers, inflammations, about this one.
Inflammation.
Ulcers, and if there is
Yeah.
any kind of trauma
Erosion.
or something. Bleeding, we will mention when we will go and talk.
Gingiva.
Talking about periodontal disease.
Yes.
We will discuss this from there.
Yes. Here we move to the conditions of the periodontal disease. We have the swollen.
There is swelling.
Yeah, there's swollen.
Hyperemia. We have the types of the biofilm, and it is noticed as biofilms. What they mentioned in the.
We have calculus.
We have dental plaque.
Dental plaque.
Calculus.
Yes.
Yeah.
Yes.
What I told you
biofilm. زعلت البايوفيلم كمان بيتحط.
What doctor? What did you say, doctor? It wasn't clear.
What do you think? I said that it was written that it was calculus. It was biofilm.
No, it is a biofilm.
I told you that
dental plaque is biofilm.
Plaque is noticed.
Biofilm.
Here we have a bleeding. We can mention a bleeding. Bony pocket, atrophy of alveolar bone, periodontal pocket. حدا يساعدني depth of periodontal pocket.
We don't know anything about this.
There is no information about it.
Yes.
We can skip it if we don't have information.
We can skip it, yeah.
And here we have the plan.
Somehow we have to plan.
Of course.
What, doctor? Sorry?
We are not skipping when we are having patients. We are checking this condition, and I told you that I'll give you full case next week.
Yes,
okay.
Yes.
This is for example, just to revise.
Yes. A plan of examination.
We said radiographic examination. Yeah.
write other
Plan of
radiographic.
examination, should we write steps that we're going to do, that we did? What do we write in the section of plan examination?
Plan of examination. Of course, anyway, we are collecting anamnesis, yeah? Because this is important. Because collecting anamnesis, this is procedure when we are asking questions and we are gathering information. So, of course, we did it. You should make it yellow.
Yes.
Collect anamnesis. Of course, we are checking. No, yeah, not plan of examination. Collect
تحت.
anamnesis.
Yes, but the mouse is.
To check, of course, we are checking. Are not you checking soft and hard tissue? Of course, we are checking.
Yes,
It
of
was
course.
written in your book that we are checking. If patient is having swollen and there is written that we did radiographic examination, this means that even RVG should be signed. And why not panoramic X-ray?
Doctor, I didn't get the idea of the RVZ.
Radiovisiograph. This is such kind of it's same like the periapical X-ray, but I told you this periapical X-ray we may have like this with films or on monitor. Okay, so everything is when we see information on monitor.
Okay.
Why are not we, for example, made there yellowish on CT scan and on panoramic X-ray? What do you think?
Because he specified that the tooth which is عم بسمع صوت.
Doctor, can you repeat the question?
Panoramic X-ray, in which case are you using? RVG, in which case, and in which case other X-ray, CT scan, for example.
Yes, I know RVG. شكله مثل RVG.
What, sorry?
Joey knew the RVZ because his father is a dentist.
Okay, it's clear, but in which case are we using each X-ray? It was written in your book, so I'm waiting from your side explanation.
You're waiting.
Okay. Let's read, yeah.
Doctor, we can use it to see the dental
when you need
plaque
what are you thinking?
and pulp.
No, wait a second. What are you thinking now? Panoramic
RVZ
gives you information about what?
What, doctor?
Panoramic gives you information about what?
About the
whole
RVZ.
the oral cavity.
Both jaw.
Yeah, both of them.
So do we need this? We need only
No.
one tooth, yeah?
No, we need only
one.
the upper
The
part,
maxillary.
the one
The
close
maxillary
to the
jaw.
26th
We need
tooth.
maximum one tooth, okay? And
Yes.
which
Yes.
X-ray is it?
We need RVZ.
RVZ.
Because he specified the tooth that's in fact affected.
Yes, because we know which one.
RVZ is a small machine.
It's like
as
the
big as
periapical.
the panoramic one.
Yes.
You said it's close to the periapical radiograph.
Yes.
Periapical radiograph. This is the same RVZ, but RVZ means that we can see view and already take X-ray on monitor.
Yes.
So, then?
After that, we move to the consultation result after checking up.
So you are doing here. So, for example, patient was having this kind of complaint, and we did, for example, percussion, radiographic examination, and everything. What you did till now? What kind of examination methods you did till now? It was palpation, it was percussion, it was radiovisiograph, or what you did till now, okay? So let's skip this one. Maybe it's clear. You already understand what we mean here, but next time you will write down here everything. And what is final diagnosis here? We are writing now down
the reason.
The final.
It is palpitis, it is periodontitis, and also specific specific code. We are having codes. Not the no. wait a second, Yosef. You are
Yes.
you need for only for you. You are writing down. It is, for example, purulent palpitation.
I'm facing a problem with these dashes. Yes, this is better.
Palpitis, for example, acute palpitis or something. Just write down, for example,
Acute
palpitis. But in this case, it's okay. Periodontitis, acute periodontitis. Sorry, write down acute periodontitis. Did you study already periodontitis and palpitis?
Yes.
No? Are you sure? Diseases. Did you study?
Yes.
No, we didn't take periodontitis.
Pathology.
In which semester are you now?
Pathology.
Which one?
هي بعد ذكره
انه يعني فيك تستعين ب
In which semester are you?
We are fifth semester. We studied the pathology.
Okay. No, I'm talking about if in dentistry subject did you pass already these topics? I'm asking this. Okay.
No.
Treatment.
ده بالأم وايد بعدين.
Treatment here, it should be written from the beginning. What kind of anesthesia you did, what kind of bar you used, what kind of preparation you did, which filling materials you used, or what kind of endodontal treatment you did. Everything, detailed information should be written. How many milligram solution you inserted and you placed, you injected in oral cavity. You are just writing down detailed information. Hussein, participate or?
Just one question before Hussein starts. You mean that periodontitis is part of the endo course? The endo.
Yeah.
Yes.
You have to distinguish. We are having localized and generalized periodontal disease, and we are having chronic and acute apical periodontitis. Apical periodontitis.
We took the periodontitis, but in the general form that it is a disease of the gum, but we didn't specify that.
So no. Wait a second. You can write down acute apical periodontitis in this case, and this indicates that this is problem of the tooth. Okay, acute apical periodontitis.
Okay. Now.
Continue. Down. Just
the treatment we are done from the treatment. After that we have the next appointment.
Okay, while you finish, I'm having some questions. So next appointment, down.
I gave him the next appointment for 20
so
to
how long
45.
How long should we
25 years.
Depends on case.
Okay.
Okay, now Yosef, stop sharing.
Stop.
We finished, but other students, I have to ask you something, and as soon as I'll finish, okay.
Thank you, Aysam.
You are welcome, Haj.
Okay. So let's start from Sarah, then Yosef, Joe, okay? When I'm asking on specific student questions, please don't say anything.
Yes.
Which techniques, can you describe me techniques for obtaining patient's history? Sarah.
Yeah, we can have questionnaires and forms for the patient to fill up. It can be before coming to the clinic or during his care. Depends on the time we can waste. We can also use open-ended questions first.
Can I add here some? How many techniques are you having? Just only questionnaires and forms?
How many techniques?
Yeah, techniques for obtaining patient's history. Just only questionnaires and forms?
Yes, questionnaires and forms or live interaction.
Patient interview.
Yosef, wait a second. Sarah, you can't answer, then Yosef is answering, and so on. Okay, we are following this. Yosef.
Yes, doctor.
How many ways are we having? How are we obtaining
We can obtain by interviews, as she mentioned, that live interaction by open questions or by closed questions. For example,
wait a second, Joe. Techniques for obtaining patient's history. How many techniques are we having?
I know 3: comprehensive examination and periodic examination.
Am I asking you examination? I'm asking how are we obtaining patient's history?
Oh, I heard examination. Sorry, the connection problem. For the obtaining patient history, we must undergo a step of asking questions to the patient and about his.
There are 2 words, just only. I need these 2 words.
what is the question? I didn't understand the
questions, questionnaires and form, and which other technique are we having to obtain?
Patient interview.
Interview.
Patient interview.
I said live interaction.
I said interview as she said the live interaction. Interview as live interaction.
Live interaction, you mean like this?
No.
Yes, you talk to him when he's there. When the patient gets there, he either fills the form or you talk to him.
I will ask him the open question or the closed question if I don't have interview with him.
Yes. I was waiting from you that interview, and you have to say this one. Okay.
I said interview.
What kind of interview? When?
What?
It is recorded. You can hear, doctor.
That's why one by one. I can't hear. Your voices are, I don't know. You have to look at this.
Some technical problems.
Not only technical problems. You have to
Doctor,
wait.
we can't hear you. The Wi-Fi speed in Lebanon is very bad.
Yes.
We pay $80 for 2 megabytes per second.
But Doctor, sorry, Joey. Doctor, first of all, Sarah said the options, and last one is the live interview. And when you asked me, I told you that like she mentioned that interview is like live interaction.
Okay. Misunderstanding. Advantages and disadvantages of this. What is it? Of these techniques? Sarah.
Sometimes the patients cannot interact, cannot talk well with the clinician because they don't have the skills usually, or let's say they're panicked, or they're anxious, or they're hurt, so they're thinking about the pain instead of answering very clearly to the clinician.
Okay, what is advantages of these questionnaires?
Advantages, you can ask the questions very detailed, and the patient has enough time to answer them.
Questionnaires.
Yeah, the paper. The advantages of it, you can save time. This is what you're asking?
Save time.
Save time because you can place specific questions you want the answer for.
We can add the specific questions in our questionnaire, but it can't. It's in some cases it can't be obtained, include, but we can add the specific questions that we need.
True, but the disadvantage for the questionnaires, I'm not sure if you ask disadvantages or advantages. Advantages is saving time.
Advantages. I'm asking you advantages.
Okay, so something other than saving time?
Saving time, okay. So, Yosef.
Also advantages?
No, wait a second. I will. What do you think? We discussed this one. What is the meaning of chief complaint?
Chief complaint is the main reason why the patient visited the doctor. For example, it is the primary reason, or as the case we've mentioned, we've studied right now that he is having bleeding and pain in the 26th tooth.
Okay, so
main cause to go to the dentist.
Yes, the main reason.
The main reason why, yeah, chief complaint or chief concern, yeah.
Concern, yes.
I need something. What kind of questions are we asking, Joe, to our patients?
Me or Joey?
Joe.
Joey.
Can I?
Joey, your turn.
Joey.
What?
Okay.
Your turn.
What kind of questions are we
Yes,
asking?
doctor.
What kind of questions are we asking?
Closed questions.
والمفتوح.
Only closed questions?
There are open questions also, but closed questions, we ask them like, do your teeth hurt, and which tooth is like...
For us, which one is more informative, open or closed?
Of course, open. Open is like, how can I help you? And tell me more about your problems.
Can you please say what kind of components of the patient history have? Components of patient history. How many paragraphs are we having?
Components? Yes, we have, I think, demographic data, which is a basic info, like your number and your address.
Okay, demographic data is clear. Then, what are we asking also?
We have the why he came, the chief concern, we say.
What else?
The general health history.
Are you reading, Joy?
No, I'm looking at you, doctor. How can I read?
Very, very easily, because I don't know how, but students are making these things so easy.
You also have the medication history or the...
Doctor, I'm having also connection problems. I cannot open another site. I pay $100 a month for Wi-Fi, and they treat me very bad in Lebanon. That's why I want to...
Stop complaining. He's the main concern now.
This is now our chief concern, yeah?
Yes, he's the chief concern of this lecture.
Okay, so what else? What else, Joy?
I don't remember so much.
تاريخ الشخص.
There are three, doctor.
تاريخ الشخص.
What else? Yosef, come on.
Medication history.
History of the patient and medically.
Medical
What?
medication.
Yes, if he's done any surgeries before, if he had
Prescription and prescription.
Okay. What kind of clinical examination methods are we having? Reem Ahmad Al-Bawli.
Yeah, we have physical examination.
Can you talk more loudly, please?
We have physical examination.
Then?
And intraoral and extraoral.
Yeah. What else?
And we have also periodontal
examination.
And we have examination of the teeth. And finally, we have the radiographic examination.
Joy, can you describe me what is physical examination method? What does
Yes,
it mean?
it's easy.
Say, because you were mixing. You submitted several times physical examinations. That's why I'm asking.
I
yes,
will.
Yeah.
Joy will.
Or Yusuf.
No,
Joey.
Joe.
Yes, it's like we have.
We have what?
Vital signs.
What else?
Vital signs. ما تعرفش يعني سارة؟ like hypertension, for example, and the blood, heart failure, for example.
No. Who can add?
Can I answer?
Yeah, Sarah, please.
It is when you look at the person's gait, the position he's standing, the way he walks, or even the facial expressions, or
the ability to communicate.
Yes, and the way his mouth exteriorly looks. This is part of the extraoral also examination, but
yes.
it appears physically.
Wait. Extraoral. Reem. What is extraoral examination? How are we checking? Reem Ahmed Al-Bawli.
Yes, so we are examining the neck and the head, and we are examining for the extraoral.
What exactly, for example?
For extraoral, yes.
Yeah.
So we have facial symmetry, and we can check also thyroid gland, and the ears, nose, and eyes, and we can check also the lymph nodes.
It includes everything that affects the mouth.
Yeah. How are you checking?
What?
How are you checking? Okay, you can see, but even to check thyroid gland and lymph nodes, it needs some action to do. What are you doing? How are you checking, for example, lymph nodes?
For the lymph nodes?
Yeah. Who knows?
By
Can I
biopsy?
answer? By palpitation.
No, biopsy. No.
What's a palpation?
We can
By palpitation.
Yeah, sir, I heard. Palpation.
we can palpate.
What's happening in intraoral examination, Fatima?
Yes, doctor. We are now looking inside the teeth. Are you hearing me?
Inside the teeth, only inside the teeth. Are we having?
Inside the mouth, everything in the inside the mouth. Now we are looking about the teeth symmetry with along each other and their surrounding of gums.
Everything.
The gums
So what's
surround.
having in the oral cavity? Periodontal examination. Alexa will answer. Periodontal examination. Don't read. Alexa, stop. Don't read.
Periodontal examination is when you check the tissues that hold the teeth.
I don't know. You have to answer.
When you examine the teeth that hold the teeth in place.
Yeah,
right?
but how are you checking? I'm asking. How are you assessing periodontal condition? Okay, Hussein. What kind of things are we checking when we are saying periodontal examination?
You mean
Yes, say.
The periodontal examination is when we search for the problems in the supporting structure or tissues that surround the teeth. For example, as we mentioned in the case, we have a bleeding in the mucosal area around the teeth or in the gingiva.
Or the gums.
What else? You missed
Periodontal examination.
I can hear. What?
Since صوت عندك voices too.
I have connection problems.
What else?
Teeth mobility.
Teeth mobility, yeah.
Yes, the dentist
spaces
checks
between them
for excessive
also.
mobility.
Yes, we put you showed us a video when they put two instruments in front and
Yes.
and behind
Better
the
than
teeth
using the fingers.
Where
yes.
are we feeling this information? Where are we feeling this information?
In the periodontal examination.
Where? No, we are having special.
At the end.
Sharpening.
Yeah.
When?
Charting.
Periodontal chart.
When?
Charting.
Periodontal chart.
ايه بنلعب بيها ليش؟
What is biopsy? You can say.
Biopsy. Can I say? Okay.
Even several times, Joy. I think that it's not clear for you. Yeah. Go.
Okay.
Yeah.
I'm not hearing very well. شو عم تحكوا عني؟
Joey, when we use biopsy?
The biopsy is the removal of a tissue sample in order to determine the disease.
So?
It's to further examine the tissue.
Diagnose. In dental industry, we usually use it to see if there is a malignancy.
Yes, pathologic diseases.
Evaluation of pathologic condition.
It may be
Yes.
cancerous.
Yes.
For example, carcinomas or.
Okay. So. Now, please, who is attending this lecture? Can you write down your names in chat?
Yes.
بين ساعتين I need an hour to write mine.
Joey Gregory Charbel Shubaya. Also, Nana Tsitskishvili is attending with us.
Wait a second, where is our chat?
Doctor, we will not disappoint you. We are your clever students.
I'll see.
You didn't recognize that?
I recognize. So, sorry. Alexia. Ara. Hussein. And Yusuf. Are we totally 7? Okay.
7 years.
Wait 1 second, please. Sarah.
There is also Marilyn. She's not in the call, doctor.
But she left because the power was off.
No point. Because you can't recover this lecture, by the way.
What?
Oh.
You can't recover this lecture.
Doctor, this lecture is graded over how much? 2?
Evolution system. I will check and I will say not 2. Maybe I don't know. Maybe less than 2. I don't know.
Doctor, but we are having so much connection problems. We can barely hear you. Marilyn left because of her connection.
Yes.
And when you talk to me, I put my ear like this because I cannot hear you very well.
Joe, you can use earphones. This is not a complaint.
My earphones are sorry, AirPods.
I will get you ones.
Yes, I don't have money.
Okay. Why are you laughing?
He's laughing at me. He's